This is Dr. Daughter today, Dr. Midwifery, doctor in it's a midwife and a doctor. So that's amazing to have you here, daughter. I don't know, maybe you want to introduce yourself, daughter. I think it's such a great pleasure just to go and don't be humble. Just tell us all about you.
Thank you very much, Suzanne. Good evening, everybody. I want to specially greet my boss is here with me, Dr. Margaret Eze. She's also in the house. Good evening, ma. Good evening, everybody.
Thank you. Thank you
Yes,
very
ma.
much.
Yes, ma. My name is Dr. Sample. I'm a registered nurse, a midwife, a public health nurse. Had a bachelor of degree in nursing, master's in maternal and child health, and PhD in midwifery. I work with the Nursing and Midwifery Council of Nigeria as a nurse there. So that is the brief description of myself, Susan.
That's fabulous. And we're so honored to have you here. And congratulations again on the big achievement. So the floor is all yours. You can go ahead and then let us know about all your work.
Thank you, Ma. I am presenting on Mother's Perception on Non-pharmacological interventions for labor pain relief in selected federal hospitals in Nigeria. And I have my co-authors, Professor Faith Diorgu and Dr. Halima Musa Abdul. Please, next. Hello, Suzanne. Thank you. Introduction. Labor pain, as we all know, is widely acknowledged as one of the most intense forms of pain experienced by women and represents a significant aspect of childbirth process. It is a very complex, subjective, and multidimensional phenomenon influenced by physiological, psychological, environmental, and social-cultural factors. Smith et al. 2020 and Oza et al. 2020. Next. Susan. Thank you. Inadequate pain relief has been associated with increased maternal anxiety, stress, dissatisfaction with care, and negative birth experiences, which may have long-term psychological implications on the mother. Consequently, the provision of appropriate pain relief during labor is recognized globally as a fundamental component of quality maternal health care. The World Health Organization emphasizes that labor pain relief should be safe, it should be respectful, and also responsive to women's needs and preferences. Next. Mother's perception of non-pharmacological labor pain relief is a critical determinant of its acceptance and utilization. Perception shapes expectations, influences their decision-making, and affects the effectiveness of care interventions. Negative perception may lead to underutilization of these methods we are talking about, while positive perception can enhance engagement and satisfaction with care. Therefore, understanding how mothers perceive these interventions is very critical and very essential for improving maternal centered care during labor pain management. Next. Despite the increasing advocacy for these methods, there is limited empirical evidences on mothers' perception of these methods within Nigerian federal healthcare settings. Most existing studies have focused on clinical effectiveness or midwives' perspectives, with less attention given to mothers' viewpoints. This gap in knowledge highlights the need for studies that explore maternal perception in order to inform policies, practice, and education. Next. So these are non-pharmacological labor pain methods, as we all know, refers to techniques that alleviate pain without the use of pharmacological methods. These methods include breathing exercises, massage, maternal positioning, relaxation technique, hydrotherapy, emotional support, aromatherapy, warm compresses, movement, walking, as we all know. These approaches are non-invasive, they are cost-effective, and easy to implement, making them particularly suitable for low-source settings such as Nigeria. In addition to addressing physical discomfort, non-pharmacological methods also target the emotional and psychological aspects of the mothers, thereby promoting a more holistic approach. Next. Thank you. So the objective of this presentation is to examine the perception of mothers on the use of non-pharmacological labor pain relief methods in selected federal hospitals in Nigeria. So by providing insights into mothers' experiences and viewpoints, the study aimed to contribute to the improvement of labor pain management practices and enhance the quality of maternal health care services. Next. The research design. The overall study adopted a sequential exploratory mixed method research design to comprehensively explore the experiences of mothers and midwives regarding the use of these methods we are talking about. So the design is that of the sequential exploratory mixed method design. The quantitative component is that of the cross-sectional descriptive approach. So for the purpose of this description, for the purpose of this presentation, the quantitative aspect of the study using a cross-sectional descriptive approach will be presented. Next. The study area. 6 federal hospitals from each of the geopolitical zones were used for this study. As you can see, we have 6 geopolitical zones in Nigeria, in our country. The Northwest Zone, where a teaching hospital, Ahmad Bello University Teaching Hospital was used. The Northeast Zone, North Central, Southwest, Southeast, and that of South-South. Next. The sampling size and sampling technique. For the quantitative aspect of this study, 160 mothers were used using the random sampling. Then the method of data analysis. For the quantitative aspect of this study, we adopted a descriptive cross-sectional design. Then data were collected using structured questionnaire, analyzed using descriptive statistics such as frequencies, percentages, and measures of central tendency. The instrument used is that of structured questionnaire. Next. Hello, I guess. Then for data management, the validity was done by 3-man expert panel, data entry, SPSS 25 was used, and the descriptive statistic mean standard deviation was also used. Next, the results. Next table. Yes. For this first, this table shows the social demographic characteristics of the 100 for the mothers. As you can see, the variables are the age, the educational status, parity, gestational age of the mothers. The table shows that majority of the mothers were in their 20s, late 30s, in their 20s to late 30s, and had a secondary school education and also with 1 to 4 children, and most of them delivered vaginally. Next. Then, for the perception of mothers on the use of these methods, as you can see, the findings indicate that, sorry, the table is not too clear, but the findings indicate that mothers express negative perception towards the use of non-pharmacological methods of labor pain relief with a grand mean of 1.00. Mothers actually agree that, yes, these methods are cost effective, they can reduce anxiety, they can reduce fear, but they cannot completely relieve their pain. So they still believe in the pharmacological labor pain relief. That is the most significant of this study. Thank you. Discussion of findings. Mothers' perception on these methods, as I have earlier said, reveals that mothers had overall negative perception of these method. Although they agree that it is safe, natural, and capable of reducing their anxiety, but they still believe that it cannot completely eliminate their pain. So they still need pharmacological methods. Then the discussion of findings, the perception of mothers on these methods. These are aligned with Botteg et al. 2019, who reported that women often perceive these methods as supportive, but insufficient for managing severe pain during labor. And also, SN et al. 2023 observed that many women still prefer the pharmacological labor pain relief. In contrast, Bajo et al. 2022 observed more positive perception when multiple non-pharmacological methods are being used, when you combine them, suggesting that they may influence satisfaction. The findings therefore suggest that education and expectation management during antenatal care may influence their overall perception. Conclusion: these methods are widely recognized as valuable supportive interventions. However, their utilization and acceptance are influenced by maternal perception, the healthcare system factors, cultural belief, and availability of resources. Next. And strengthening antenatal education, improving communication between mothers and midwives, and providing supportive labor environment may also enhance the effectiveness and acceptance of these interventions. Mothers view non-pharmacological as less effective than midwives did, highlighting the need for better training resources, education, and cultural awareness for effective use in these hospitals that were used. Next. Antenatal classes offer mothers the opportunity to learn about more about this non-pharmacological labor pain relief before delivery. It will also help. Then the findings from this study show that mothers who understood these techniques, such as breathing exercises, massage, maternal positioning, warm compresses, were better able to cope with labor discomfort. Next. Breathing techniques emerge as a valuable coping mechanism in the study, helping mothers remain calm and focused during contraction. However, their effectiveness depends on prior familiarity and practice. If they had had information about this technique, it will really play a very good role for them to accept it and really use it during labor. Then pregnant women can also use online videos, group discussion in order to enhance these skills. Midwives and antenatal educators should encourage daily practice as part of routine pregnancy wellness. Recommendations. By discussing options early with the mothers, either during antenatal visits or during antenatal classes, midwives can tailor interventions to suit the mother's comfort, cultural background, and physical condition. Support also from family members also play a very important role, or birth partners, husbands or family members can also be allowed to be around during labor. It will also go a long way in helping. Next, please. They should also be involved to choose birth partners. It can be their spouses, can be friends or relatives in antenatal training section that covers massage therapy, warm compress application, assisting them with movement or positioning during labor. When partners are actively involved, they provide both physical relief and emotional reassurance by reducing their anxiety and sense of isolation. Next. Then healthcare administrators also have a very big role to play. Also, the policymakers, they should prioritize these methods and integrate them into the hospital guidelines. Hospitals should also ensure that essential resources are available for nurses and also for the mothers during labor. For further studies, and also further studies should be conducted to explore the effectiveness of specific non-pharmacological labor pain technique in reducing pain. Next. So these are some of my references. And next. Thank you very much.
Thank you so much, daughter. And I think this is a very interesting finding, and we have some time for questions and answers. And thank you so much for being so thoughtful about time so we can start the conversation. I feel that I have, there's already some questions here in the chat box, but any of you who want to ask questions, please raise your hand and we can give you the chance to ask these questions orally. Carl, do you feel that you want to talk, or you're okay with me reading your question? Because I think coming from a doula, I think this is a very interesting question to ask.
Okay, I think we can do that.
You can read? Okay,
yes.
Perfect. So Carol asks, hi Carol, nice to see you. Pain mitigation is an important role that doulas play in the labor and delivery process. Are midwives traditionally making space for this work to happen as part of their practice? Let's ask this question in the context of your work, for example, in Nigeria, daughter.
Pain mitigation?
Mm-hmm.
So what is
the space of doulas, for example, in Nigeria, to kind of strengthen this option of pain mitigation through non-pharmacological pain relief?
Okay. Doulas. Midwives traditionally making space for this work to happen as part of their practice. I think so. Doulas. Sorry. Can you hear me?
Yes, I can hear you.
Sorry.
Yeah, or maybe are doulas part of the health system, not part of the health system, but to your experienced daughter, have you seen doulas maybe in Nigeria working?
Doulas is not a popular thing in Nigeria. So yes, I've not really done anything on that, so I will not be able to speak on that. Yes.
Yeah, I think that's an excellent.
I will. Yes.
Yeah, I
it's
think
something. It's something to really look at.
Yeah.
It's
And I
something to
think
really.
thank you for asking the question, Carol, because I think that's where the in conversation starts.
Okay.
I think maybe for those of you who are not familiar with doulas, um,
Mm,
and I could be wrong, and Mary Carol, you can add into the chat as well. Doulas
okay.
are an excellent support system that help, particularly in those situations where non-pharmacological pain relief are needed or could be
Mm,
hangs, right? Through a specific focusing on giving massages or training families into how to reduce the pain perception in
okay.
during labor and birth. So I think that's
Okay.
how the question was coming in. And it's interesting though to
Mhm.
see that maybe the term doula, or maybe as we
Mhm.
do understand as doulas, are maybe not
Mhm.
necessarily well recognized on or
Mhm.
identified in
Mhm.
Nigeria. So that
In
I think that's a
Nigeria,
very,
yes,
maybe that will be an interesting research question, daughter,
definitely, yes,
to see where
yes,
doulas are, or what are the roles, or maybe
yes,
there's another name that we have for doulas in Nigeria.
yes. That would be very
Yeah,
interesting.
maybe they are
We
already,
will.
they are there. And Carol has
Yes,
already offered she can come and help. There you go. We
yes,
have found a bird. I
yes.
think that's a very, very good question,
It's a
actually.
very researchable
Yeah.
topic. Yes,
Yes, and you have your teacher and your supervisor here, so that will be an
yeah,
excellent
yes,
research
yes,
topic.
yes. We can work
Um,
together to look at it.
yes, we have
Mm.
one person who's raised her hand. I'm just gonna ask you to unmute, and then you can go
Okay.
ahead.
Okay. Abdul.
Oh,
Yes,
there.
good evening, my doctor.
Yeah.
Congratulations. Congratulations for the latest
Mm.
achievement.
Abdul. Zainab.
Yes,
Good
yes, this
evening.
is
How are
Zena.
you?
Good
Yeah.
evening. Thank you
Mm.
very much, and congratulations on the a wonderful presentation.
Mm.
Yes, I think from the explanation of your facilitator concerning the doulas, I
Yeah.
think it's something that we do in Nigeria, though it is not
Exactly.
institutionalized.
It's
That
not.
is not institutionalized because from the meaning, it's somebody
Mm.
that is not medically trained that stays with a woman in labor.
That is
The
not
person
medically
stays,
trained. Like
yes, that stays,
TBS. Are we talking about
yes,
TBS?
something like that,
Traditional birth
something like that,
attendants. Okay.
something like that, that
Mhm.
they will
Mm.
provide all other care to the woman in labor and immediately after delivery. In fact, it can be a relative that will be taken care of, like this omugo of a thing that they do in the East, something like that. We
No,
Mhm.
can
Mugo,
liken it.
the person has delivered. This
Yes,
one,
that doulas
is it
also
not during labor? With
it
what
extends, it
Susana is saying?
extends, yes, it
Yeah.
extends beyond labor.
I think
That
it's
person,
already sparkling so many questions.
Mm.
Uh, and I feel like Carol, I think this is a great example of
It
when
is, yes,
midwifery and doula world and then birth world, in fact, can interact and start the conversation. I
yes.
have to say though that to my knowledge, it's not the same as traditional birth attendants, so it's not the same as TBA.
Mm-hmm.
TBAs are have have been perceived as traditional or indigenous midwives in some part of the world. But doulas, they do have, to my understanding, Carol, and this also differs around the world, they have some
Mm-hmm.
training. Some of them hold certificates, and they actually
Mm.
have a very strong body that recognizes their work. There's some parts in the world that their work has been recognized as a way to not only decrease pain, but actually to enhance the quality of care and to support to the experience of birth and or the
Mm.
course of pregnancy and postpartum as well. There are postpartum doulas to their pregnancy and labor and deliver birth doulas as well. So I think that is a very good, especially because there is seems to be some different definitions about are there doulas in Nigeria? I think that would be a
Yes.
great question to ask first. And then what
Yes.
is the definition of doula and how this definition actually maybe overlaps with something that's already happening in Nigeria. I have to tell, for example, I'm coming from Peru, and then doulas are becoming more and more known from that term, because it's also a I don't know where the name doula came, but in Latin and Hispanic word, it didn't exist as it. So it took a lot of advocacy or so for people to be recognized as doulas. But I think so
Okay.
Carol has already said here, like she had to go through training and get certified, and is considered a traditional health worker in the US. So I
Oh,
think that
okay.
would be an excellent,
It's like it means different things in different countries.
of
There
course,
may be, with
yes.
what you're saying, in your country, in some countries they are trained, while in some countries they are not trained. For
Mhm.
Nigeria, I don't think we have this set of people that, like what Zenat was saying. She
Mhm.
was referring to them as maybe people that will come and look after a woman that delivered or stayed with her during and after delivery. And so it means different things to different persons. So we will look at that. We will look at
Yeah.
it.
And
I
maybe
have,
just exchange your email addresses,
yes,
because
yes,
I
I
think
have,
that would be,
yes,
yeah. And
I
maybe
have
after
Abdul
you
Wahab.
find that, you
Yes,
can run your research again and then see
yes.
if having doulas might change the perception of non-pharmacological pain management. I think that
Yes.
would be some. And then you come and then present it to the IDM.
Yes, the next year, yes,
Yes.
is something that we need to work on. Abdul Wahab, you are here. We will have to put heads together. My boss is here, Dr. Margaret Eze. We will do something, and you will hear about doulas in the next
Okay.
There you
in the
go.
next
Interesting.
year.
Well done.
This is the idea
Interesting.
of
Next year,
VIDM.
yes, VID.
This is the
Yes,
idea
ma'am.
of VIDM, to create the
Yes.
questions and being
Yes, I don't
curious.
know. I don't know whether my boss had heard something about doulas before. Ma,
Hmm.
have you heard
Um,
about doulas?
yes, I know there is that uh something called doula, but
Mm.
because they are trained but non-medical professionals
Mm.
Hmm.
who assist women during childbirth and even after childbirth.
After that,
But
do we have
they are
in the,
non-medical professionals. But we don't have
them
dollars
in
in the
Nigeria?
Nigerian health care system.
Yes, ma'am.
Yes,
In
yes.
the yes, we don't. What is I can liken to dollars are what we call traditional birth
Birth
attendants.
attendant.
They are people who take care of women in labor and childbirth in the remote areas. Those
They're
who
not
don't
trained. Are they
come to the
trained?
clinic. Some of
Yeah.
them are trained. Some
I
of them
mean,
are trained.
formal
Hmm.
training.
They
Mm.
don't go through formal education, but
Yes.
they can learn through
Mm.
other wives, old
Yeah.
Mm.
wives, and there is a
Mm.
skill they develop over time, and they
Yes.
assist women give birth in remote areas where
Mm.
there is no medical facility and things. It's
Um,
not,
Yes.
but
Yeah.
Dwellers
Okay.
are not recognized in Nigeria. It's not in the
mm.
part of the healthcare system, just as we see in other countries like in the
Countries,
US.
yes.
Because I know in the US, maternity women are, assigned. There are dwellers assigned to them who monitor them through pregnancy. When it is reaching childbirth, they help them, refer them to the hospital where they will give birth. But such thing does not occur in Nigeria for now.
Okay. For now, you said the word
Yes, for
for
now.
now.
Yes.
For
Mm.
now,
That's
yes.
amazing. Thank you so much for this insightful discussion. We're going to give the mic to Kioma. I ask you to unmute, and then maybe she or he, sorry, has another question.
Mm.
And then we also have a comment here from our midwife from Shanaz from Pakistan. They do not know the concept of doulas. So I think, Carol, you are already making people question what's going on with the maternity centers that we don't know about doulas around the world. Okay, Kioma, I think you can talk now. You have the mic on. You can go ahead and then ask your question. We cannot hear you, Kioma. I don't know if you're asking something or you're using the mic.
Yeah, I
There
think
you
you
go.
can hear me now. Yeah. So I said I just wanted to respond to the issue of Daula. First of all, I will thank the presenter, daughter, Dr.
Thank you.
Daughter, for this wonderful presentation. But what I want to say concerning the Daula, in some institutions here, like in Aminu Kano Teaching Hospital here, what we have is what we call them birth companions. They equally act like those Daula. So Daulas that are not actually trained, they are women, or specifically that a mother or a relative that have experience as regards to childbirth. So any woman that have experience as regards to childbirth can stand in as a doula. So in Aminu Kano Teaching Hospital here, what we use is birth companions. They allow the birth companions to come in form of doula to assist, give a kind of massage at the back and to relieve pain, and then give some psychological support to the woman while she's in labor. So we don't actually call them
Call
dollars
them
here.
dollars. Yes.
We call them birth companions. So that's what I
Uh,
Thank you.
wanted to say. Thank you.
there you go. I think we have
Thank
started
you.
our qualitative project here, like asking,
Yeah.
do you know
Yeah.
about doula? And then we have them birth
Mhm.
companions. So probably that's a name that
Mhm.
we're giving them in other parts of the
Okay.
world. And I
Mm.
agree with Carol. Carol has mentioned doulas work side by side with midwives in
Right.
the US.
In the US.
Yeah, I am located in Canada, and I know the doulas also work with us in the
Mm.
labor and delivery. And there are some of our clients that they also want to have more support during their birth. And then while the midwife focuses on the clinical aspect and support of the client, the doula offers full support to the emotional, spiritual, and holistic care. So, and they are the ones actually that support the non-pharmacological. Maybe that's why, maybe, daughter, I'm just creating a hypothesis here. Maybe that's
Yeah.
why some of the clients didn't have a good perception about non-pharmacological pain relief,
Yes.
because that
Yes.
piece of who uses or who
Mhm.
um, applies the non-pharmacological pain
Mhm.
relief, that is the piece missing, maybe. I don't know. I'm just creating some
Yes.
hypothesis here.
Yes. Yes.
Anyways, you have the connection from Carol, and then she says that she is willing to travel wherever you are, and then to work on this in this big question.
Yes. It's something that we need to look at.
Yes, totally.
Yes, we need to look at it.
Exactly.
Mm.
Okay,
This
so
is my first time of hearing that word, doulas. I
you
tell
never
you.
stop learning, don't
Yes.
we? Right? We
Mm.
always learn something every time.